Welcome to the Anatomy of the Vulva and Clitoris, a Her Time Therapy 15-minute workshop. Our mini workshops in sexual empowerment are a supplement to our larger series. Go to hertimetherapy.com to learn more. This workshop will help you accurately identify the anatomical structures of the vulva and clitoris, understand the reproductive emphasis rather than pleasure perpetuated by purity culture and the patriarchy, and also that your pleasure is not a bonus or gift. It is a priority and you deserve it. In the 20 years that I've been seeing clients, more clients than not have never been taught about their own body's form and function. Many clients have never even looked at their own anatomy. In this workshop, I will be using language that may feel uncomfortable or words you've never heard of before. I encourage you to try and sit with the discomfort, asking yourself why this is hard for me to hear. Learning about how your body looks and how it works specifically related to pleasure empowers you to speak up in the doctor's office, say yes or no in sexual moments, find your pleasure solo or with others, and above all, you can speak clearly about your body. There are parts of society that don't want people to understand how their bodies work. Empowered people ask questions, speak up, self-advocate, and say no, instead of staying small or giving in to keep someone else happy. This workshop is so much more than, hey, this is your vulva and clitoris. It is about connecting with your body and taking control of how you see it, celebrate it, and use it. Are you ready? Our next slide includes a drawing and medical language. The vulva is the name for the external genitals on a female-identified body. Note that I did not say on a woman's body. So here's a mini lesson in a mini workshop. Identity goes like this. Anatomical or biological sex assigned at birth by a doctor or midwife when they catch the baby. They look at the external genitals and say, it's a female or male. It's not incorrect, but it's not the whole picture. It excludes intersex bodies and impacts folks whose gender identity is not based on their genitals. Gender identity is how our brain sees our body. For some folks, their brain sees a woman in a male body or a man in a female body. There's also a spectrum of identities that don't fit the binary of male and female. But don't worry, we'll have a mini workshop on gender identity, I promise. For our purposes in this workshop, I will be using the term female to refer to the body. All right, so let's get back to our drawing here. At the top of the vulva, we have the mons pubis. This is fatty tissue over pubic bone, and it's protective cushioning. On top of the mons pubis is where the pubic hair grows. And the pubic hair can grow on the mons pubis, down the labia majora, and even down onto the thighs, and sometimes even up and around the anus. We are hairy creatures. So I want to take note really quick about pubic hair. And for some folks, this can be really contentious or vulnerable, this next piece that I'm going to be talking about. We live in a society that has stated a vulva looks best when the pubic hair is removed. And we want to really push back against that sentiment because full removal of pubic hair is removing the development, the aging of the body, and taking it back to a prepubescent time, as in a time before this body was old enough to grow pubic hair. Pubic hair is part of a natural development as we go through puberty and as we age. Pubic hair can be beautiful. Pubic hair is part of our vulva. It is part of the body. And so I encourage you to question your relationship or really look at your relationship with your pubic hair. Ask yourself, why am I removing it? Who am I performing for when I remove my pubic hair? And you might answer that and say, nobody. I just like to remove my pubic hair. And that's okay. But for many of us, looking a certain way in our vulva by removing pubic hair is for somebody else's gaze, somebody else's desire. All right, so moving down from the mons pubis, we have the labia majora, right? And again, these are made of fatty tissue. They're here for a protective function, right? Internally from that, we have the labia minora, or the inner lips. These are highly vascular and sensitive. They also come in a wide, beautiful variety. They typically are not symmetrical. One lip will be a little bit longer than the other. For some folks, they're long. For some people, they're short. For some, they're extra wavy. They come in all different colors, and they really are a beautiful part of our diverse selves. As we move back up a little bit from the labia minora, we see the clitoris. And what they've labeled here is actually the clitoral hood, which is a protective piece of skin comparable to the foreskin on a penis that covers the head of the clitoris, or the clitoral glands. The clitoral glands is the only visible external portion of the clitoris. It contains over 10,000 nerve endings, and its sole purpose is for pleasure. Down from the clitoral glands, or the head of the clitoris, is the urethral opening. Now, I can assure you the urethral opening is not this big. It is quite tiny, and this is where urine exits the body. Down from the urethral opening, we have the vaginal opening. And again, the vaginal opening does not look like this. The vagina itself is a muscle, and so when nothing is exiting and nothing's being inserted, it is quite closed. Right? It is not an open, gaping cave. So we have the vaginal opening. This is where menstrual flow or period blood exits the body. This is also if a child is being born through the vagina, vaginal birth. This is where the child's going to come out. If we're inserting anything for penetration, things like tampons to capture menstrual fluid, the disc that captures menstrual fluid, the cup, the diva cup, things like that, those will all be inserted here in the vaginal opening, right? Into the vagina. This is also where things for pleasure can be inserted. Fingers, tongues, toys, a penis, right? That is where penetration occurs. In between, and it's not labeled here, the vaginal opening and the anus is an area called the perineum. It's very soft skin, much like the rest of the skin of the vulva. It's very sensitive, so be really gentle. I recommend using lube for any sort of play, finger play, any sort of penetration, toys, etc. Lube helps to protect the skin and the sensitivity of all these areas. And then finally, we come to the anus. Lots of nerve endings around the anus, and certainly just inside can be a place for penetration. The anus is where we poop out of, right? Just to clarify all that, folks. But this is a place for penetration. So people who are interested in anal play or anal sex, you can insert toys, fingers, tongues, right? And a penis. If you're inserting anything specifically around toys, they need to have a flared base, and we want to be using lube. And we want to use lube everywhere for any type of penetration. And certainly consent, always making sure we have consent before inserting anything into anybody's body. All right, let's switch over and learn more about the clitoris. So here we have a full image of the clitoris. If you look closely, you can see the pencil sketch of the vulva kind of layered over top. This helps to show just how big the clitoris is and the impact it has on pleasure for female bodies. Starting at the top, we have the clitoral glands, or head of the clitoris, which is the only external part of the clitoris. We talked about that on the last slide. And then we come down, and the clitoris has two branches of corpus cavernosum that extend down to the crus, or the legs, and the plural for crus is cura. Together, they are hugging the vestibular bulbs, and the entirety of the clitoris is made of erectile tissue. So erectile tissue is a spongy tissue that fills with blood and becomes hard during states of arousal. This pushes nerve endings to the surface, making touch and pleasure heightened. If this sounds familiar, you're right. The penis itself, the shaft of the penis, is also made of erectile tissue and fills with blood when aroused and becomes hard or erect. We are more similar than we are different. The larger parts of the clitoris can also be accessed in the vagina by pressing on the top or forefront of the vagina. So you insert your fingers, boop, right? And you make a come hither motion. The spongy spot on the vaginal wall is called the G-spot and is now believed to be stimulating the internal parts of the clitoris. And stimulation of the G-spot for some can lead to female ejaculation, or commonly called squirting. Understanding where female ejaculate fluid comes from and what it is made up of is still up for debate. There seems to be a connection to glands located above the urethra, and we also know that it is not urine, but there's not been a lot of research. There's still not a lot of understanding. But what you do know is that if you are a squirter, if you ejaculate when you orgasm or when you're being stimulated, there's no shame in it. You have not wet the bed. It is your body responding to pleasure. So just to reiterate, the entire purpose of the clitoris is for pleasure. It does nothing else. It is unrelated to reproduction, which is why we didn't have this image of the female body until the 21st century. Like in the last couple decades, y'all, female pleasure was seen as obscene, unholy, witch-like, gave them too much power, etc., by all these different societal and cultural systems. This stigma and oppression of female pleasure still exists today. So I want to talk a little bit about the physiological things that happen when a body becomes aroused. Arousal itself can occur in a variety of different ways, and I encourage you to explore that. So let's take a moment to understand what turns you on. Is it words? Is it touch? Images? Fantasizing? A partner doing the laundry from start to finish? Maybe all of the above? Understanding what turns you on is going to help you, right, connect your brain to your body when it comes to pleasure. So as you become aroused, your body increases blood flow to the genitals, glands just inside the vagina begin excreting your body's natural lube, the clitoris swells, right, fills with blood, changing the look and the color of the vulva. And as a result, the area has increased sensitivity. This process only represents the physical part of arousal and pleasure. Another part, arguably the biggest part, neurological. How is your brain turned on? For many of the clients I see, their struggles with pleasure start mentally and emotionally, impacting the physical process of arousal, pleasure, and orgasm. Learning how your mind impacts your body and vice versa can help you understand what is getting in the way of your pleasure. Let's spend a few moments understanding and unpacking orgasms in female bodies. An orgasm is a physical response to stimulation. Some people experience orgasm through nipple play, all by itself. Many bodies experience orgasm through clitoral stimulation. That is, the head of the clitoris is rubbed, licked, flicked, teased, etc. And others experience a deep orgasm by stimulating the G-spot. This typically involves direct pressure, some movement, or a bit of both. Orgasms, despite the hype, are not required to enjoy sexual touch, penetration, or other sexual behaviors. Often, if the only goal is to have an orgasm, the pressure of achieving one will prevent one. As mentioned before, our brains are our largest sex organs, and the pressure we put on ourselves to perform perfectly sexually often robs us of the opportunity of being present in the moment and possibly robs us of our orgasm. As we close out this mini workshop, I want to encourage you to write down this reflection and work to answer it. What do you call your genitals? Is that name positive, kind, empowering? And does it help you feel connected to your body? Listen to how your body responds as you read this question aloud. Continuing to explore and learn about your body is an act of defiance against the patriarchy, regardless of your anatomical sex or gender identity. Knowledge is empowering and provides opportunity to speak up about what works for you, to be able to hear from a sexual partner about their desires, and to enhance your sexual experiences. Thank you for joining me for a Her Time Therapy mini workshop. Go to hertimetherapy.com to schedule a free sexual empowerment consultation with me. Be sure to sign up for the newsletter to learn about our upcoming sexual empowerment workshops. Your recommended reading for this workshop is A Celebration of Vulva Diversity by Sam Hill Atalanta. It is a joyous and heartfelt compendium of vulvas.